Okay. Hello. I think we are live. Welcome everybody to a new panel series where we're going to be tackling a rather delicate subject, competence in professional dog training. I'm joined as always by the best thinkers in our profession, Academy staffer Christy Benson, Lisa Skavinsky, owner of Dog Educated in the Rochester, New York area, and Emily Priestley, owner of Wild at Heart in the greater Victoria, BC area. Emily's book, by the way, is now available and it is highly recommended. It is on the subject of living with herding dogs in regular family settings. You can find it on her site, wildatheartdogs.com. To kick off this series, we'll be exploring what competence is, specifically with regard to training, behavior, and behavior modification. In installment 2, which is 2 weeks from today, we'll be exploring competence when it comes to client counseling, class teaching, coaching humans. In our meeting to prepare for this series, the first thing we came up with was the critical need for fluency in animal learning theory, operant classical conditioning, habituation, desensitization, all that stuff. And not just competency and fluency with the theory in great detail, but the capacity to select techniques and then execute them well. We also kept bumping up against how fraught this subject is, and that's probably going to come up numerous times today. On one hand, we deplore good trainers having to be the mop-up squad for incompetent training that came before, and even more desperately maybe, how incompetence among the white hats, and by that I mean us non-aversive trainers, the incompetence in our camp does us no favors. When an incompetent non-aversive trainer is unable to get the job done and the guardian then heads over to team balance training and they do give the guardian relief, that client becomes a walking advertisement for, you know what, that R plus stuff just doesn't work. And that's a serious issue. On the other hand, having been thrown under the bus ourselves, we are very aware that by tackling this subject, we are calling out, hopefully respectfully and hopefully in a helpful manner, trainers, however well-meaning, who are over their heads. In some cases, they know it. In some cases, they don't, and they end up flailing and client blaming. So, Lisa, you are in an area where the options for guardians are limited. Can you speak to the situation, how it affects you from an exasperation, from a burnout perspective?
Yes. So in our area, there's a large number of balanced or just openly admitting aversive trainers. We do have some force-free trainers, but there's not a lot of people with formal education. So oftentimes, not only am I the third or fourth person that this person has gone to over the last couple of years, but by the time they get to me, not only are they exasperated because they've been doing trainer after trainer, failed practice after failed practice, but I end up with either dogs that have been to aversive trainers who have used aversives to address real serious things like stranger aggression. Sadly, things even like separation anxiety, sound sensitivity. And now, of course, or even just in garden variety things like resource guarding, which I consider kind of garden variety. But what happens is they haven't changed the underlying feeling. They haven't fixed the problem. They haven't really modified the behavior oftentimes. But what's worse now is we've got side effects of fear and aggression. So by the time
that's as malpractice as it gets, isn't it?
Well, that's and so
you're trading a nuisance behavior for fear.
Right. And even if, let's say you're successful, shocking a dog into learned helplessness, which is sometimes the case, it will be in certain contexts. But now we've exploited fear and pain. So we have those attendant side effects of fear and aggression. So by the time they get to me, I now, this is now the issue. And that for me is burnout, because now I've got to undo damage for a dog that, is afraid of the training setup, already afraid of the world. And before they were counter surfing or jumping on people, or maybe they were growling when someone got too close to their food bowl, things like that, which is a problem. On the flip side, I have numerous clients that come to me after going to non-aversive trainers, positive reinforcement trainers, who, just didn't quite, they piecemealed their education together by doing seminars and reading books, or any of those things that you can get some bits of information, but they don't quite know what to take and what to leave. So we end up with trainers that are well-intentioned, that have little bits of protocols, but not full understanding of how to create a training plan. They're kind of conflating, they're confusing They're merging, operant plans with classical plans, not quite sure of what they're doing, and what's at play. Things like having a dog to sit when another dog goes by, but not understanding parameters, not understanding order of events, mechanics, timing. So owners are coming to me with these little pieces of, we tried this, but they didn't do it in a way that was going to be successful. So what we have now are people coming to me that they've spent
They're
a lot of
exhausted. They must be, they're
money
exhausted. They've been financially exploited.
and their time, and they're starting to believe their dog's not capable of getting better, or there's something wrong with them. They're doing something wrong, which is very, very sad. They're just doing what they've been instructed in. So we're talking about people, their time, their resources have been expended. The good news is, especially in those cases where we are talking about things like resource guarding or garden variety nuisance behaviors, it's quite easy. And if the first trainers were not using pain and fear,
At least things aren't worse.
the very first appointment with me, they're shocked at what they're able to do, just because we're using a good plan. It's a little tougher when you've got the aversives crowd that they go to first, because now we have dogs that we've that they have exploited fear in, used pain in. So, but I'm not convinced. It's hard on the owner either way. It's hard on the owner to spend that kind of time and money to either have things made worse or things not get better. So I get very frustrated. It's exhausting. I don't always have room to put.
And remind us, I mean, you're usually booked like 6 months out. And so
On
people who
average,
need good training are
Yeah.
not even able to, I mean, even if they sort of, find their way to you after, having their time and money wasted, they have a wait. And that's not ideal for dogs who are, and for clients who are probably losing patience.
Yeah. And they've
We
already
need more
time
competent
and
practice.
money.
And we should, and you raised a few things. So, sort of underlying processes to the point where in sort of really usable detail what operant classical conditioning are, how to do it, and then being able to, build a competent plan, understand what parameters are, do an incremental, standard operating procedure, and then execute it, and then coach the client at executing it. And build all that. And that's not an easy feat. And as we were, talking just before this, we were talking, Christy, about the part of the thing that we feel paralyzed about, because, we don't want to throw people under the bus, but ideas are up for discussion. So we want to make a distinction between critiquing ideas and practices and ad hominem attacks. We don't want to ever engage in the latter. But people get very upset. So, but if we critique a technique and it's their pet technique, sometimes people get very sensitive about it, and we feel we don't want to offend people. But on the other hand, this needs to be talked about. I mean, Christy, you were saying that one of the things that sort of was annoying you is that people failing to identify DRIs. Can you talk a little bit about that?
Yeah, I think, if I look at the list of things that you first came, when we first started talking about competence, Jean, you came up with this big list of, very quickly off the top of your head, you're like, here's what a competent dog trainer really needs to know. And one of the things that I think that you came up with that's so important is to be able to sort of operationalize what you're doing, operationalize your plans, to talk in terms that everybody can understand. So in terms of operant and classical conditioning and how dogs learn and ethology, use those terms to talk about sort of what you're doing.
Like it's kind of like in medicine, you can't have some doctors calling a pancreas the spongy thingy, and others calling it the pancreas, and others calling it the insulin thingy. Why we need to have some common underlying language of gross anatomy, just like in dog training. That's kind of what you're talking about, isn't it?
Well, and I know we've talked about fads already on our conversations, but I think one of the things that seems to happen is there's a fad that's a DRI, so a new behavior that people will start to train in, and it's sort of treated as your word, Jean, as the panacea for any behavior problem, any, welfare problem, any fear problem. Use this DRI. So we have it, we have people.
But they don't call it DRI. They
don't call it DRI. So there's this new word, which I get is like very attractive for us humans. We're all like, oh, something new, something pretty for my chest, So we like latching onto these things and using them. But I find for people who are like, here's a new thing that I'm doing, if you ask them, operationalize it, well, what kind of training is it? What kind of management is it? what are the steps? What are the parameters of this plan? How is it helping? I find people tend to get a little bit resistant to answering that, and I
They
find
get
I'm
angry.
confused by it. Now, I love a good DRI, and I have definitely changed my
Mhm,
mind
me
about
too.
what are good DRIs in different situations as I see other awesome trainers pull out these amazing DRIs. And sometimes our clients have a DRI that they like, so go with it, right? I'm not against using different behaviors in situations where they make sense, but I definitely think that we all need to have the competence to be able to say, oh, that's a DRI, and here's why it's useful. And yes, maybe it's because it is more along the lines of what the dog wants to do in that particular situation or whatever. But I do feel like one of the things that makes us competent is being able to look at a new fad in our field and say, that is a DRI or a classical procedure or R minus,
Desensitization, an
and
attempt at
be able to sort of pick it
desensitization,
apart.
or
Yeah. So I guess I would just say to anybody who's coming into our field or is new, to just be aware that it's not a bad thing if there's new DRIs or new, ideas about how we treat things, but we need to be able to talk about them, like you said, in this shared language, Jean, and to really be able to not just jump on the fad boat and be like, I'm going down the river.
And part of that is, that competence means you have to understand animal learning to the point where you can identify the underlying process.
Right.
In other words, not just sort of it's rebranded and then somebody says operationalize it. I'm wondering sometimes they get angry because they can't operationalize it, and that's alarming. If somebody can't understand in great detail, you're a professional, the underlying animal learning process and how it works. That it does suggest that if you can't even identify it, are you then using it optimally? Are you it does suggest sort of it is very much the doctor who's missing physiology 101.
Yeah.
I see that so
I think
much.
there's always the fear that if they're using a technique that they can't operationalize, that it's straying into aversives. I think that there's the possibility of that for sure.
Mm.
Yeah, and this is something that I see so much on social media right now and this is, I think, why it's going to be so hard to unpack competence right now, because social media has really muddied the water, because people can put out whatever they want to put out as fact, and it sounds really good sometimes.
And they might be
really
competent at
fancy.
social media.
Yeah, they might have 200,000 followers on social media.
Mm.
There's times where I'm watching, an account and for a minute I have to stop and say, like, wait a second, and I have to, go back and like sort of unpack what they've said. And it could be something as small as they're confusing counter conditioning with desensitization, or something like that. But it can make a huge difference when you're actually working through a case. And just because somebody can sound sciencey while they talk does not mean that they have an education, does not mean that they didn't just wake up one day and decide to be a well-marketed dog trainer. And so I think we just have to be very, very careful when we're shopping around for professionals that we're avoiding. And this is where it's hard, right? How does the layperson understand the difference between, they don't. And if I'm having trouble and I have to go back and rewatch and I go, wait a second, that's not right, how is my client going to know the difference? And I know we're going to talk about education later on in other sessions when we get farther into this topic. But I think education is where, like, if you're looking for a trainer, please, please, please take time to go to the website and see. Like, I always go to a website, I click on like about me or about us, and it will tell you where they went to school, where their education, what education they have. And alarmingly, many of them do not have education listed. And so be warned on social media if you're looking for a competent dog trainer to help you, especially with the big things, fear and aggression. Make sure you're vetting that person and don't go by their social media account necessarily.
Well, the problem with that is not every the layperson doesn't necessarily know. And of course, I'm not going to name what programs are scary out there, but they may go and say this person, is a master trainer and has all of this education. The other problem
It's unregulated. Anybody can say anything.
But most out there, most professional trainers, regardless of what camp you're in or your philosophical beliefs, most of them are out there kind of cobbling together an understanding of dog training, and bits and pieces of protocols do not lead to good outcomes for dogs and their owners. And I think that's the problem that we're constantly facing in and out. Like I say, folks will come to me with bits and pieces of protocols that make some sense. But they're not executing them
We
correctly.
tried that operant conditioning stuff.
Yeah.
Yeah.
But I get it, because I did the same thing. Like, before I became a dog trainer, and I wasn't trying to become a dog trainer, but trying to help the dogs in our rescue. And we were not finding effective, efficient help locally amongst professional dog trainers. So the president of the rescue and I, we would read all the books. We would go to all of the seminars. We'd go drive 3 states away to go to a full day or a 2-day workshop by this particular person or that particular person. We'd come back with bits and pieces, and we didn't know whether to decipher this is useful versus this is, bias and crap and not useful. We didn't know how to do it. It wasn't until I actually got an education, a formal education with a specific curriculum that was very thoughtfully put together to understand how animals learn, what drives behavior, so I could now use critical thinking.
How can guardians possibly do it? How can they separate the wheat
I
from the
was
chaff?
a guardian, and a rescue volunteer, and I did my best, and I went to.
I mean, you were self-selected, somebody who's extremely interested, extremely keen. How does a guardian navigate it out there? And as you say, I mean, I see trainers all the time. They sort of flail, and they often flail sort of in social media groups saying, "I've got a case, and it's it's stumping me. It's something I've never seen before." And they listen, and it's actually very bread and butter. And they say, "I'm doing this, and they're kind of like." And again, it kind of sounds like what you were describing when you started out, where they grab a little piece here and they try it and they think, well, okay, I tried blah and it didn't work, but they didn't actually try blah. They because they don't even understand it.
Well, they took
and that's
strands of it,
really
like
alarming.
Spaghetti, and you throw it against the wall. And
It is spaghetti at the
doesn't
wall.
stick.
Yeah.
And then
I think there's also like
based on that, it's a problem.
I think there's also there's a problem of people not understanding the basics of animal learning theory and operational or being able to operationalize what they're doing. But then I think there's also and this sort of builds on the fad thing, people who don't know what techniques are are appropriate for which behavior. And I think, sometimes, lots of times techniques you're going to be able to use operant conditioning for many things,
some are kind of all purpose.
Right.
But for us, when we go into a dog training case, we have sort of in our back pocket a list of techniques that we're going to use that have a vetted, known history of working for these problems, because not every dog is a study of one, and not every behavior is.
And as you say that, I'm thinking about sort of the hierarchies out there. We say, okay, we must exhaust these things before we go to this, and those things. I mean, they worry me for a number of reasons. Those hierarchies, they in theory, what a grand idea, but of course, nobody wants to use aversive. I mean, there's no need to use aversives at all. But the idea that we first, have to, guardians don't have usually that kind of bandwidth and time, and especially if they've been through multiple practitioners, that isn't it better that if somebody presents with appendicitis, that we do surgery rather than first we try conservative rest, and then we try antibiotics, and I mean that worries me a lot too. And so what you were getting at sort of is the idea of being able to think critically, which means the fad resistance, knowing when a certain presentation in a case is amenable to certain standard operating procedures and training plans, and then and then knowing when there's a zebra. When is it something that is different, and that we need to dig deeper, we need to refer, etc. And being able to do that is part of our job, and I don't see that being done as well as we might like.
It's almost shocking that people who flail because they don't necessarily have enough education are really reluctant to refer too,
yeah.
When it seems like I'd be referring all the time. So there's things I don't know, so I refer immediately.
Yeah.
So I think part of competence is really being comfortable with referring. If you don't,
being gleeful about
referring if you don't like it, but
yeah,
you don't have the confidence.
yes,
but maybe it's just because they're so constantly in that position of flailing. They've just become habituated to the feeling of not really knowing what they're doing. I don't know.
And there's so many.
Casting.
What I see locally so much, and I want to be careful because I want to be really thoughtful, and I know people are doing their best out there, but what I see so often, it's almost like so many trainers are like one skilled trainers, like they know how to do basically a DRI downstay for duration. And listen, I'm all for any kind of plan where you can get the dog out from underfoot, have them do something. And especially if you've got a really rock solid, incremental plan with, an interval.
Yeah, for the record, we love stays. I mean, stays are very handy.
Yeah. So that's all great, but I'll see that it's used for everything. Great. You want to go to your mat and a long duration downstay for, anything from when you're cooking to when someone comes through the door, so they're not jumping on guests. All of these things, DRIs are good, but I see them applied to every single
as some sort of mental health measure.
Right. It's like literally everything. And especially like, yes, can you teach a dog with separation anxiety to do the relaxation part? Like, sure. Is it at all touching the underlying?
Is it the right tool for the job?
Separation anxiety. Is it changing stranger fear? No, you've got the dog out from underfoot when the stranger comes through the door, hopefully behind a gate. And the thing is, we understand, we recognize that if you do have a really solid foundation and understanding of animal learning and behavior, we recognize that you can use DRIs if we are really, really incremental in our.
And we're going to use them in different ways, depending. If we have a dog that's got fear and anxiety, we're going to do it in a different fashion than if we're just dealing with the nuisance behavior. And then why are we doing that? And then how do we do that? And what are the operating procedures? And then there's the execution and the mechanics. So there are a lot of layers to our job. And sometimes trainers have, they have little bits here and there, and that,
use them for everything because it works for some things.
Yes.
They don't have the depth of understanding to know, okay, I'm facing a situation for which a downstay may not be. Know what I'm saying? It's a very tough situation to get people who don't know what they don't know to know they don't know it. We're having a problem with.
It's hard.
It's exhausting, and and burnout is something that keeps me up at night. Dog trainer burnout. The good, competent dog trainers, that they're inundated. They're often the second or third trainer. I worry desperately, and they're doing it in a war zone where people are unable to sort of, separate, aversive from non-aversive. Why should we care about that? And then incompetent non-aversive versus competent non-aversive, and then we have to sort of, delicately tread those waters. And the burnout issue is a real thing. And can you imagine a world where there was sort of mandatory competence standards? Mandatory, and also the mandatory no more use of strong aversive stimuli. No more shock collars, no more digging prongs into dogs. It's just not legal. Like there is sort of, that's happening, but it's it's not yet here in this country. And
the problem with the burnout is there are so many people that write to me behind the scenes, trainers, and they have slowly removed themselves from maybe not the profession, but from social media or from, discussions or, whatever it might be, even in small doses. And we don't even know the numbers of who's affected. So we'll never know. There's just people who are silently suffering and struggling because of this very issue. And that's the part that really, every time we have these conversations, I have people that write to me that say, thank you. Thank you for, saying this and for speaking up, because I can't do it anymore. And heaven forbid those
you get attacked for saying something like, competence matters, and can you please operationalize that's seen as somehow a hostile act.
Yeah. And you can't be in groups where you could help people. So there are groups of dog trainers. I long ago left those. Yes. I won't name any of them, but there's groups of positive reinforcement trainers, because God forbid someone is wandering in the desert and spinning out of control over some simple to address behavior issue for their client, and you give them guidance. And first of all, you take your time, which is so limited, to help them to understand, and then it's a mess. You literally, people get, like you said, they get offended if it's, they feel it's a criticism. I just can't be in, and also just seeing how much incompetence exists out there. That alone is very deflating.
We originally, what kicked off this entire project of our panel was us being thrown under the bus, because we were labeled as extremists, and that, we dare to sort of take a stand and say, non-aversive training is absolutely just not okay. It's not necessary. Yay, it's not necessary. And it's not okay. and getting thrown under the bus for that. And so, we're very now sensitized to like, God, if we then call out, competence on our side or competence on their side, that all of that is sort of, God, we mustn't do that. We're going to be labeled as being not positive or something but this sort of, this is this sort of epidemic kind of very kind of sick positivity, that this mandatory positivity about everything, that all techniques are the same and everything's the same and all trainers are doing a good job and everything is good. And like, well, wait a second, but what's the reality? I mean, the reality is that not everybody's doing it very well.
You're damned if you do, you're damned if you don't.
Can't we talk? Maybe we can do it respectfully, but can we talk about this?
Yeah.
I think Emily had a really good point about the difference between throwing somebody under a bus and then what was it?
Someone
accountable for professional understanding of their craft, of their
being held accountable as a professional, taking money for hire.
Yeah. I mean, social media is, I'm going to keep going back to it because it's something that has me burnt out right now. If we're talking about burnout and competence, and I see so much, you could have an account that is, 500 people, or you could have an account that is 300,000 people. If you're putting out very detrimental information packaged as fact because you aren't ready to work a case in whatever way that might be, then, I think you are setting yourself up that you should be held accountable. I don't think that we should just allow people, like, we go back, Jean, you talk about, doctors and the appendix or whichever, that those things we're kind of joking about, but this is malpractice. And so there is, it's very similar that if you're going to go out and you're going to put yourself out as a professional in our field, it's one thing to throw people under the bus, which we won't do. It's another thing to say, look, if you're going to say you're a professional, you got to back up I won't swear, you got to back up your stuff, right? So, and that's what I think we really need to do, is start holding these people accountable. But we're under.
But how do we do that? I mean, it seems to me an unregulated profession is. It's almost like asking for in some cases it's the unscrupulous who just want to make a buck or seeking fame or whatever it is their underlying motivation, versus people who unwittingly they're trying to do well, but because there's no holding accountable, they can flail. I mean, there is no sort of, you have to graduate medical school and then complete a residency and then you can be sued for malpractice if you F up in a significant way. None of that exists.
None of that exists.
And so it's basically it's up to the individual to police themselves, and
they may not know that they don't know that.
They don't. Well, yes, that's right.
What's hard.
They don't know, for sure they don't. Yeah.
And I want to say, because there's no regulations, there is no formal testing, there's no licensing, there's no oversight body. We all know this, we say this over and over again, which at the end of the day is the problem. People not understanding animal learning theory, how to implement procedures. That's always going to be the issue. It's going to be the issues in shelters. It's going to be the issues in rescues. It's going to be the issue among dog owners. And certainly it's the issue among dog trainers. So we're kind of in this, it's a climate that in an unregulated industry, people don't have to know things to say they're an expert in things. It's on us to prove that they don't know anything. Who's got that kind of time? I'm not going around trying to discredit local force-free trainers. I don't have time for that. I never would want to do that to a human being. But here's the thing. They want to learn. They want to know. They do attend those seminars, by the way. They do read these books. Their intentions are good. They don't realize that maybe they do. I shouldn't speak for whether or not they realize or not. I would look at my case history and say, I'm not resolving cases. I probably need more education, and maybe not everyone does that.
Or I should refer out those cases.
If I was failing case after
maybe case, I'm the problem.
I would look at myself as the problem. And for some reason, folks out there don't do that.
Clients get blamed a lot. I mean, sometimes the dog case or the case type gets blamed, but very often I find my experience has been that the client gets blamed.
They do. You shouldn't have gotten this dog. You aren't doing this right. You didn't do the way I told you to do. You didn't do it at all. And by the way, that's an incompetent trainer who's not capable of coaching the client to get the job done and to do it in a way that isn't going to make them run to another trainer.
You're setting up our next week discussion. We're going to sink our teeth into that next week in a huge way.
I
Because
think so.
client coaching and counseling is just a whole other skill set, you know?
Right.
I think before we sort of sign off, something that I think maybe you said, Lisa, is just, going to, us, our community, our constituency is going to these seminars, learning things that maybe aren't true, or learning just sort of like the shiny parts of things without knowing how to unpack them. So I would put it out there that, in my opinion, competence matters extra if you're going to be educating dog trainers. So I think, yes, competence is very important for all of us as dog professionals, but if you're going to go out there and start educating dog trainers, you need to be even more competent. You need to be competent at educating, at pedagogy.
You have to triply understand the underlying processes, and yeah, you're purporting to teach others. Yeah.
Yeah. So not just, I did this on my dog and it works, so now I'm going to go off on the seminar circuit. I think, there really has to be a higher bar.
Yeah. It's a tough situation. And I'll tell you, even to this day, like now I go to these seminars in part because it's other colleagues will go that I get to see, and that's inspiring. Having conversations at dinner and talking about things,
and hoping that there will be
some learning from that. Most of the seminars themselves, I'm happy to come home with some really good reframes to give clients. Some people have clever ways of explaining things that are complex to clients, and I get a lot of those at some of these seminars. But I'm not coming away with entire protocols, and nobody's delivering on protocols. You don't have time in a 1 day or 2 hour or whatever. So people should know, if they're trying to get an education in this way, that's not what these seminars are for. That's not what they do. You're not coming away from a seminar with a full, a full training plan and a full protocol. You're literally coming away with tips and bits and pieces, and it's just not enough to get the job done and to get it done efficiently and effectively. So I think people should know that, because I wish I had known that. I spent a lot of time and money going to seminars.
Same here.
Take nothing back of value that would change the behavior in those rescue dogs we were trying to help. Now we can. And that's the difference. So seminars are fun.
Yeah, would it be, is it overstating to say there's sort of a crisis in our profession? Or, crisis is a very strong word, but crisis, sort of an unacknowledged crisis of competence.
I almost think crisis is an understatement, if I'm going to be honest.
And I don't know if it's unacknowledged as much as it is unacknowledged, but it's also misunderstood, not understood, I don't think people know that they shouldn't be charging people money to train dogs. I'm sorry to say that, but I think there are lots of people charging people money to train their dogs, and they have no business doing so. And I don't say it to be hurtful. These are predators that live in our homes, and we really owe it to them to understand them and to understand the whole thing, not bits and pieces.
We didn't really get much into, I don't know if we've got time, but to get into sort of, we talk about sort of, behavior modification. So understanding, all the processes of animal learning, but we really didn't get into the side of, we got to also have really good understanding of ethology. We need to understand principles of animal behavior. What's normal? Yeah. When do we normalize? And we can also normalize and modify, or normalize and not modify. How do we make all those decisions? And to do that, you've got to have an understanding of animal behavior in general. I think you need to have an understanding of how, evolution works to understand, then understand how domestication is superimposed on that. And partly just so we can explain things to clients, but partly because we need to have deep understanding of how behavior works, not just how behavior modification works. Any thoughts there?
I agree. I think it would be really hard to do our job if we didn't have that level of sort of the breadth and the depth about dogs.
I think we've lost Christy.
Elon Musk.
Just exactly when she's going to come back in a second.
And also, I know I keep coming back.
Christy, you broke up. Can you start that over? You broke up a little bit there.
Yeah, sorry, my internet is unstable. I was just going to say I agree, and I think that dogs really deserve trainers who have that breadth and that depth. We're not
understand who they are.
Mm-hmm.
As animals, as dogs, and their specific breed.
Which is interesting because the more qualified dog trainers that I'm around, so the more education they have, the more laid back they are about normal dog behavior. And that's just like when I'm, you know, like we're at a conference or we're at a seminar and I'm around people that are really educated, we're so laid back about these normal things. But the farther away you get from that, it's amazing how all of a sudden it's like almost like a
Everything's
red
needing-
flag.
People get alarmed.
Yeah.
Yeah.
People get
yeah.
alarmed by the
Everything's
dogs moving. People get alarmed by the dogs, you know, like mine just was barking, like, oh my gosh, you know, they're
Pathologizing.
aroused, you
Yeah.
know.
Yeah. What's
normalizing normal dog
what's
behavior is a critical
what's
thing.
pathology? What's not pathology, but needs modifying because it's not fitting into human environments? What's non-pathology and probably needs mainly normalizing and a bit of management. And that's, you know, that's a whole, you know, knowledge set.
Oh, it is. And owners need us to know that because they're going to be pathologizing. They're going to be assigning, oh, my dog's doing this because he's spiteful, stubborn. You know, they're going to be seeing things through a human lens because they're not. This is the same reason I can't take apart a car engine, but a mechanic can. It's not my specialty and I wouldn't attempt to. There's a noise in my car. But honestly, owners don't always, I mean, we got a few that self-select to learn more, but generally speaking, owners are going to worry about things like a dog growling because you got too close when they had a bully stick. Whereas we have the ability to say, here's the good news. This is a normal dog. We can normalize, we can explain why dogs resource guard because we do understand the evolution, you know, the evolutionary biology of it. We understand that, you know, domestic pressures, you know, have lifted those constraints, but we still see it. We might see buggy versions because why is the dog
and it helps the owner take it less
crying over
personally.
tissues? Yeah, we can kind of give the owners good news. This is what it is. It's normal. This is where it comes from.
And then put on our modification hat and efficiently modify it.
And management. Like, and for some owners, if it's like two adults in the house and the only thing the dog guards is, you know, their marrow bone, you've got the option of saying, you know, leave your dog alone when he's got.
Yeah, it's not
There's
the
no
tip of some,
children,
it's not
right?
the tip of some iceberg that means, you know, he's going to stay up at night and it means that there's something going on. What does it
They
mean?
might attack somebody.
Yeah, and there's numerous
reason.
examples like that where you have to know, okay, so what does this suggest?
But you see that, and I see that locally. I see dog trainers that they panic. You know, someone will say, my dog growled after he threw up and we went to clean it up and the dog growled at me, and they'll be like, oh, you know, and then now you're going to.
That means
$700 for private training because your dog's deviant and he's wired wrong and blah, blah. And you're like, come on. You like owners are being exploited as well by incompetence. So
kind of, you know, it has smacks a little bit of fear of dogs too. You know, it's one of our favorite topics, you know,
because if you don't understand dogs, then you're going to fear.
You're going to be afraid.
Don't understand.
It's also hard to be the trainer that comes in after the fact when someone says like, I need $1,000 to like, you know, correct your broken dog who's growling over, you know, vomit on the ground, to be the person that comes in and say like, I'm educated and actually it's totally fine. Maybe we don't even have to work on it. We can just put the dog outside and clean up the vomit. Like, it's just, you know,
you have to navigate that. It's almost, I mean, it's our jobs are hard enough without also having to be, you know, like professional diplomats about the kind of the prickliness of colleagues who don't want to be asked to operationalize or don't understand what's normal. And it's exhausting, isn't it?
Exhausting. And I frequently find myself saying, and I know Christy has said this before, you're not going to throw anybody under the bus. I'm very obviously professional when someone comes to me and say, you're my fourth trainer. I've been to this trainer, this trainer, and this trainer. This is what's been done. This has not gotten better. This is why. My first thing out of my mouth isn't like, well, you shouldn't have gone to those people. You know, my first thing out of my mouth is, I'm sorry, on behalf of this industry, it's an unregulated, not everybody has an education in animal learning and behavior. And the people who pay the price most are owners who are looking for help. So on behalf of the dog training industry, I'm very, very sorry. But here's the good news. We're going to get you some help. You're in good hands.
Yeah. And you know, honestly, the dog guardians who cling to the mythologies that their previous trainer sold them, I think contribute to burnout. Like I had I know this is one of my favorite stories I tell Jean, but a woman came up to me at a event once and told me about her dog who went to a 2-week board and train and by the end didn't even know how to sit. a 2-week board and train, but she was defending that trainer, you know? She
Yeah.
was like, well, no, I mean, I can't even remember what her myths were, but I was just like, I'm sure my face
That had
couldn't
ended up
get
being
these
dog
things right.
blaming.
Yeah, like I'm like, I could train your dog to sit in 5 minutes. Like but her like fighting back on behalf of this incompetent trainer.
It's like a sunk cost fallacy.
Sunk cost fallacy.
Yeah, I was wondering that too. Yeah.
And so then we're just like, we're having to climb that mountain too. Like, oh, I know, he's so great. Who couldn't get your dog to sit in 2 weeks?
Yeah.
If a board and train, and that's the other problem, you know, there's cult of personality in this stuff. So if certain trainers are very charming or confident and, you know, they're selling themselves as a personality,
Humans are going to be
without
humans.
capability or competence. So, you know,
Well, let's save the rant about charm for another session, because I think it would fit good with next time.
and again, the last thing we want to do is sound like we're super judgy, but the bottom line is it's an unregulated industry.
What do we do? I mean, what are we supposed to do?
Yeah.
Yeah.
It's hard.
Well, thank you as always. It is a fraught topic, and thank you to everybody for tuning into this extremely. It's a delicate subject, but it's one I think that needs to be talked about for the sake of dogs and for the sake of their guardians. Thank you, everybody.
Thank you.
Thank you.
Bye, guys.
Bye.